NHS trusts routinely collect feedback from patients, but it's hard to know which feedback is the most important and how best to use it to improve care. EURIPIDES is a 5-part study designed to examine how feedback about inpatient experience is gathered and used in NHS mental health services. Our study uncovered a number of things. Firstly, around 1/4 of trusts struggle to collect patient experience data. Half of the trusts collect it but don't use it, leaving only 1/4 that are currently using it to support change, and that where change is happening, it's often environmental rather than cultural. We found that people often prefer to give detailed feedback towards the end of their inpatient stay, but no one is ever too unwell to say how they're experiencing their care. If staff don't listen to people when they are ill, they are less likely to receive feedback later. People value trusting relationships with staff when they are in hospital, and this influences whether they're willing to give feedback about their care. Many only feel comfortable giving feedback to someone they trust and often prefer to give this verbally. So staff need the time, support and skills to be able to listen and respond. Patients also told us that giving positive feedback was important. Although staff appreciate this, many believe their trusts only take action when patients complain. This means that the chance to learn about what we do well is lost. Positive or negative, dismissed feedback makes patients feel powerless and potentially damages those vital relationships. Staff sometimes thought feedback was just collected for official reports, rather than as a way to improve care, and this feeling is reinforced by not knowing what happens to feedback after it is given. Families and carers told us that they would like to give feedback too, but sometimes they worry this might affect the care their friend or family member receives. Perhaps the biggest lesson from EURIPIDES is that it's important to use patient feedback alongside quality, safety and outcomes data. While the latter tells us where the problems are, honest feedback gives us the kind of insights and knowledge that may point us towards the best solutions. To read the study in its entirety, or just to find out more about how NHS mental health services use inpatient experience feedback, please visit the link below.